Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, June the 3rd, 2020. Joining us today, Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. The work to confront COVID-19 and stop its spread in our community is continuing, and I want to once again thank Toronto Public Health under the leadership of Dr. Eileen Davila, our Medical Officer of Health, and Public Health Board Chair Joe Cressy for the work that they and the entire team that work with them do to continue this task and continue to meet this challenge here on the ground in Toronto. I want to also acknowledge the work that the province is doing to increase the testing and to roll out more provincial testing sites in our city. And I want to urge all Torontonians, if they have a symptom of COVID-19, if they think they've been exposed to someone who has COVID-19, please go and get tested. When I met with my fellow mayors and chairs from the GTHA earlier today, in addition to a continuing and unanimous concern about the urgent need for significant financial support from both the provincial and federal governments, they positively noted the increased testing and strongly encouraged the province to provide for more mobile testing in more places as soon as possible. Now, Dr. Davila will be providing an update today on the detailed work that Toronto Public Health does tracking this virus in our own community and how we have massively expanded our ability to do this work over the last 3 months. Together with those efforts, in the last few weeks, we've also been working slowly and carefully to reopen our city. We've opened many parks amenities that were closed. We've worked to help retail businesses that were closed to reopen in a safe way. And we've brought back many city services to regular service levels. Today, I'm happy to announce that after a review of the emergency measures regulations and recent changes, all licensed street food vending, food trucks, and ice cream trucks in the City of Toronto are permitted to operate as of today. This change comes just in time for the summer vending season. It's important to note that for everyone's safety, all operators must adhere to physical distancing requirements for the public and provide proper health and safety measures for their staff. Just like visits to other businesses, residents visiting street food vendors, food or ice cream trucks should maintain a distance of 2 meters or 6 feet from others while waiting in line, for example. This is good news for our mobile food industry, an industry that has been growing in our city since we cut the red tape entangling food trucks several years ago. All license and permit holders in that industry can renew or obtain their new licenses with municipal licensing services by contacting mlsapplication@toronto.ca. I know that restaurants and bars are eagerly awaiting the day when they will be able to reopen, and I dare say more than a few of their customers share that anticipation, especially as summer approaches. As you know, restaurants and bars remain closed to dine-in service due to the province-wide emergency order, an order that came after our own strong recommendation that these locations close their dining areas in order to help stop the spread of COVID-19. We are working with the province and public health to figure out both a timeline and under what conditions these businesses can reopen their dining areas safely, and we're continuing to work on a plan to help open up more patio space for restaurants and for bars. We are in active discussions with the province on some of the regulatory aspects of that patio plan and anticipate providing more details to you in the next few days, an initiative that I believe will be of scale and therefore very helpful to businesses which are struggling in this sector. Now, this weekend, we will have more than 10 kilometers of major roads open to cyclists, runners, and walkers as part of our active TO program. This will be the largest active TO weekend yet. The Lakeshore Boulevard West closure from Windermere to Stadium Road will be back, along with Bayview from Front Street East to Rosedale Valley Road and River Street from Gerrard Street East to Bayview Avenue. And new this weekend, allowing us to pass the 10-kilometer mark, we will also be extending the Lakeshore Boulevard East active TO installation further west to Leslie Street. Cyclists, runners, walkers will be able to go from Leslie Street to just south of Woodbine Avenue, Q Beach Avenue, along the eastbound lanes of Lakeshore Boulevard East. This is just one of the ways our active TO program is working to free up space in our streets so that people can get out, can get active, and can keep their distance from others consistent with public health recommendations. Finally, as you know, throughout the pandemic, I've been encouraging our staff to get work done now while traffic volumes and TTC ridership are both lower due to the ongoing restrictions and the pandemic itself. This has led to much additional road construction taking place on an accelerated basis in many different areas of the city. The TTC has also been looking for ways to accelerate construction wherever possible. To accelerate the accessibility project at Chester Station, the TTC will be closing that station starting Tuesday, June the 9th, and reopening it on the morning of Tuesday, June 23rd. This 2-week closure now will save many weeks of overall construction later and allow the TTC to open the new Chester Station elevators in the early fall. As an added local benefit, the TTC will also be able to accelerate concrete work to reopen a well-used walkway just north of that station. This is exactly the kind of common sense action people expect us to take during the pandemic, and I want to thank the TTC passengers and local residents for their patience and understanding during this closure. It will be short-term pain for long-term gain. Every day we're making progress in moving our city forward and finding ways to help people. These 3 items that I highlighted today show that progress in action. We are making progress in helping more businesses to reopen and to restart. We are making progress in giving people more space to get outside and stay active and healthy. And we are making progress in getting the projects done that we know must get done to keep our city moving and working and accessible. If we can stay the course, if we can continue to do things the Toronto way, supporting each other, caring for the most vulnerable first, and maintaining civility and respect even in the most stressful of circumstances, if we can reaffirm our commitment to the Toronto way, then I know that that will give us the right stuff to move to much brighter days much sooner. And on that note, I will ask our Medical Officer of Health, Dr. Davila, to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 139 new COVID-19 infections in Toronto. To date, 8,948 people have recovered, an increase of 165 since yesterday. As always, for more detailed data on the status of COVID-19 cases in our city, I encourage you to please visit our website. I continue to receive questions about case investigation and contact management. As it relates to COVID-19, this is a critical aspect of the work we do at Public Health to protect our community. In Toronto, unfortunately, we are still seeing approximately 150 people newly diagnosed with COVID-19 each day. For each one of these individuals, a key role of local public health is to investigate how the person got their infection and to identify and follow up with people they unknowingly exposed in the days leading up to their confirmed diagnosis. This is what is known as case and contact management. Case and contact management is a complex and time-consuming process. The first step in this process happens when we are informed of a positive test for any communicable disease, including COVID-19. As soon as we receive complete contact information for someone in the community who has tested positive for COVID-19, a skilled case investigator connects with them to start taking a thorough history. On the face of it, taking a detailed history may not seem like something that requires a great deal of skill, but it is more complicated than it might seem. In the case of COVID-19 investigations, the history taking includes working with the person to recall all of their daily activities and who they came into contact with in the 2 weeks prior to the onset of their symptoms. We ask them questions about what symptoms they have and when they started, what activities they did, and what locations they visited for the 2 weeks before symptoms started, and who they came into contact with during this 2-week period. For many of us, trying to remember this level of detail for what we did yesterday is challenging. It is even more complicated when you are being asked to recall this kind of detail from 2 weeks ago, especially when you are sick with COVID-19. This is why it is so important to have skilled investigators on the job. In addition to having great communication skills, investigators use interviewing techniques and memory aids to help people reconstruct the past 2 weeks' events before their symptoms started. Getting as much detail as possible is important from a public health point of view to help us identify where and how people are becoming infected with COVID-19. Aside from this investigative work, we also follow up with those who have tested positive through daily phone calls to check in with them, to see how their symptoms are, and to ask about their general well-being as they recover. As just mentioned, the information gathered through our detailed case investigation efforts helps us to pinpoint where and when the person may have become infected. Equally important, however, is identifying anyone who might now be infected because of contact with the case we are investigating. In this step of the investigation, public health staff assess the potential health risk to those people who have been exposed to a COVID-19 case when they were infectious, and we do this using an evidence-based risk framework. We look at things like the type of contact involved. Do they live in the same household? Are they co-workers? If so, in what kind of workspace? And how closely do they work with each other? We also assess the duration of the contact and then categorize all of this into a list of close, non-close, and casual contacts. We obtain information on those identified as close contacts and connect with them, advise them of their exposure to someone who has COVID-19, and ask that they quarantine themselves to reduce the potential spread of COVID-19. We also provide them with advice on when to seek testing for COVID-19. The number of contacts for each COVID-19 case can vary depending on an individual's living, work, and social situations. Some people have very few points of contact, especially since public health and physical distancing measures were put in place. In these situations, the work of following up on contacts can be completed quickly, sometimes within a few hours. More complex contact identification that involves many close contacts across jurisdictions can take much longer. This was certainly the case at the beginning of our COVID-19 outbreak back in January, when people were moving around much more in our community. And it may be the case again as our city opens up. Case and contact management is critical to containing virus spread and keeping people in our community safe. It helps reduce the spread of COVID-19 at the individual level by identifying where someone may have become infected and who they in turn may have infected. This data also helps to determine how COVID-19 is spreading through the community to inform our public health strategies to contain the disease. I cannot emphasize enough just how valuable the details gathered from our case investigations and contact management efforts are as part of our work to protect your health. As we seek to safely reopen the city and ease public health restrictions, case and contact management will be especially important to combating COVID-19 in our community. In this context, my team has taken unprecedented measures to scale up our capacity to meet these demands. due in large part to public health interventions like vaccines. Thankfully, most communicable disease outbreaks have a limited impact on the health of our city. But COVID-19 is different. Here, we are dealing with a new virus to which no one is immune and for which we have no specific treatments or vaccines. As a result, we are seeing many Torontonians get sick with COVID-19 at a scale that we have never seen before. On average, we manage about 45,000 cases of all communicable diseases at Toronto Public Health each year. So far, there have been almost 12,000 COVID-19 cases in the last 3 months in Toronto, and we continue to manage other communicable diseases. However, we have quickly adapted to this new reality. At the very beginning of our COVID-19 response, we had 50 staff working on case and contact management. We have since mobilized over 550 staff to conduct case investigations and contact tracing. We have also partnered with the Registered Nurses Association of Ontario, the University of Toronto, other local public health departments, and a number of other agencies to boost this workforce by 200 more. To put this in context, our case and contact management team is now larger than most other local public health departments, and given the ongoing need, it continues to grow. In addition, despite staffing up, as we were responding to COVID-19, we found that the existing provincial communicable disease data system used by all local public health units was not equipped to support the work of managing an outbreak of this magnitude. Given this new reality, my team partnered with the city to build a new case management system in an unprecedented 8 weeks during this global emergency. We did this to better and more quickly track test results, hospitalizations, and deaths. We are also conducting area-based analysis of our data to track the impact of COVID-19 in our city. This has been a truly unprecedented outbreak for us at Toronto Public Health. Never before have we had to manage so many cases so rapidly. Indeed, this is the largest and longest case and contact management effort in our history, and I believe in Canada's history. As such, we have struggled at times to keep up with the workload because the current public health systems and processes and the ways they connect with the broader health system were not designed for a pandemic of this scale. Despite the enormity of these challenges, we have made great efforts to adapt and respond to our city's needs. In fact, while the media have reported delays in our case follow-up times, our data show that from May 27th through 29th, we were able to contact almost 90% of new COVID-19 cases within 24 hours. This rate changes daily, depending on the number of cases that we receive. However, we continue to work hard to get this number even higher. In addition, we know, based on the experiences of other jurisdictions, that we can expect to see further surges in COVID-19 activity. So we continue to put systems in place so that we are prepared. I also want to share that my team has extensively reviewed our own internal case and contact management processes to improve our work in this critical function. In addition, we brought in staff from the city's Emergency Operations Center to conduct their own independent review of our work. We ask them to do this to ensure that we do not miss any opportunity to improve our response during this pandemic and also to help us prepare for the future. My team and I are committed to making improvements every step of the way. And so, we continue to scale up staff as our local situation evolves. We work with labs to streamline result sharing, and we work with health system partners to more quickly identify and manage cases of COVID-19 and their contacts to reduce virus spread. In closing, I want to thank you for your continued commitment to our public health measures to reduce the spread of COVID-19 in our city. I know that this gets more challenging as time goes on. We are doing everything we can to protect you and the health of our city, and I ask you to continue to do the same. So please, continue to practice physical distancing and continue to take care of each other. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 85th day of continuous EOC operations. Our EOC continues to operate, ensuring that both critical and essential services are being provided without interruption. I'm proud of every member of our team who continues to work hard in support of our residents each day. This afternoon, I will provide our weekly personal protective equipment update. At present, our PPE levels remain stable, and our team continues to work hard to source the equipment we need on a go-forward basis. Our current PPE inventory levels are as follows: a 30-day supply of N95 respirators, a 159-day supply of surgical masks, a 174-day supply of isolation gowns, and an 80-day supply of face shields. Our pandemic reserve stockpile, which is in addition to the current inventory I outlined previously, is as follows: a 601-day supply of N95 respirators and a 674-day supply of surgical masks. As you know, managing PPE has been a constant challenge throughout the COVID-19 pandemic. We have encountered and dealt with numerous quality control and supply chain issues with items of PPE that we rely on. While medical glove supplies have been stable throughout our response to COVID-19, we are now experiencing issues with the availability of these items as well. Most recently, we were forced to reject a delivery of medical gloves after discovering that the shipment did not meet our requirements for blood-borne pathogen protection. As such, at our current consumption rates, we have a 46-day supply of medical gloves remaining in inventory. We are working with our supplier, and we are expecting a delivery of replacement medical gloves shortly. As we continue to transition from COVID-19 response to city restart, we are continuing to evolve and scale our processes and deployment models within the OEM and EOC. We have developed comprehensive processes that will ensure that Toronto remains well positioned to respond in a timely and coordinated manner once the province authorizes additional city services to restart. I am working directly with Saad Rafi, our Chief Recovery and Rebuild Officer, and his team to ensure that all aspects of our respective operations remain aligned and coordinated. These processes ensure that our strategic command team is able to approve the restart of city services in a timely and efficient manner. We will also ensure that the numerous assessments and plans that are required for each service to restart safely and effectively are in place before we approve service restarts. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. And for more information on active TO initiatives, we encourage you to visit toronto.ca/active-TO. Thank you.
Thank you, Chief. For reporters on the line, we have staff also on the line to answer any questions you may have, including Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care. First question is Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi, good afternoon. Mayor Tory, the federal transport minister has announced he's expanding the required use of face coverings, which could include public transit in some cases. Is this going to be enforced on the TTC?
Well, we've yet to take the decision, although we're actively engaged in looking at the law, as I've mentioned previously, to see in what way we could best issue such an order if we chose to do so on medical advice from our medical officer of health. I would note all three medical officers of health, federal, provincial, and municipal, have strongly recommended already that people should wear these face coverings when they're on public transit and other such crowded places. And we're looking now at what is going to be best and when it's going to be best for us to do anything beyond that, and so that we'll have news to report on that when we have news, but also that will have to cover the question of whether you can enforce something like this in a practical sense, and what we would do in that regard.
Yeah, and that does lead to my next question. Thank you for answering that. If the city were to go ahead with making that mandatory, what would the enforcement look like, and how much would it cost? Are these conversations that have been had at this point?
Well, certainly the question of enforcement, of course, has come up, because anytime that you put a rule or an order or a law into place, the question of enforcement has to be dealt with. This is a problem when you're dealing with hundreds of thousands of people every single day with multiple access points to the transit system, many, many different vehicles spread all across the city, where enforcement is a huge challenge, perhaps one that isn't even feasible to contemplate within the context of any kind of consistent way across the board. But that's obviously something we have to talk about. You've seen the answer that has been given by other jurisdictions that have moved to issue an order compelling the wearing of a face covering, and you might want to take some note of those, but I'm not saying in this case that we've reached any decision either as to whether an order of some kind should be issued or what enforcement measures would be undertaken together with that if it was done.
Okay, thank you. Next we go to Dave Nickel from Toronto.com. Go ahead, Dave.
Hi, I'd like to address this to Dr. Davila and possibly Mayor Tory as well. I wanted to ask about the decision to allow food trucks to reopen. It is the season for food trucks now, as things are getting warmer. But I wanted to get a sense as to what you've learned about the spread and the controls of COVID-19 that caused you to understand this to be a safe thing to do.
So shall I start off?
Sure.
Okay. So I think that what we understand around COVID-19 over time, we understand more about how it's spread. So we know that physical distancing is relevant, and that is actually one of the most important elements in preventing the spread of disease. So as long as these services, food service provisions, can be run in a way that actually allows for that physical distancing, then I think you actually have the opportunity to provide a very safe operations. There are, of course, occupational health concerns for those within the truck itself. You want to make sure that there are hand washing facilities and the like. But from a public health perspective, aside from food safety, which is always a concern, when we think about COVID-19, it is about physical distancing. And with food trucks, because they operate in the outdoors, we also know that the risk of COVID-19 is significantly reduced when you're in that large airspace outdoors compared to, say, for example, an indoor environment.
I will just add to that the following. First of all, the season, I think, caused us to focus more on the food trucks because, of course, it's more of a spring and summer type of commercial activity. Secondly, there was some lack of clarity with respect to what the orders did and did not cover. And then once you get past those two things, the weather and the law and ensuring you know what the law says, then we moved fairly quickly through issues of food safety, which are, of course, the responsibility ultimately of public health, and safety with respect to physical distancing. And those two issues really put food trucks more into the same category as the takeout that has been successfully done with appropriate care for physical distancing and food safety for some time now. So I think it was really just getting past the weather issues and feeling some pressure to restart, and also the regulatory lack of clarity, which we have subsequently clarified.
As a follow-up, I wanted to ask about Chester Station. This may have come up as you spoke, but does this acceleration of the work being done have a price tag? Is this going to cost more?
It shouldn't cost that much more, but the bottom line is we are moving on a number of these projects, within the parameters of any reasonable cost increase to get them done now, because what we're weighing against any possible cost increase, and I can make sure to get you the exact number if there is one, we're weighing that against the increased convenience for the public of the fact that we're doing it at a time when we know traffic is substantially reduced and ridership is substantially reduced, and we're getting the added bonus while we do this of being able to fix that walkway as well. So I think the bottom line here is we'll have an elevator in service for people with disability or strollers or elderly people much sooner, and we will be able to do that without inconveniencing as many people as might have been the case if we'd done it over a longer period of time.
Okay, thank you. We go next to Christina Tenalia from CP24. Hi, Christina, go ahead.
Hi, Brad. Hi, everyone. Hi, Mayor. I'm going to start my first question for Dr. Eileen Davila. Dr. Davila, I know that it takes time to do the contact tracing, I meant to say, and connect the dots. But on Monday, you were asked about if you had any information about the potential for positive COVID-19 cases from the previous week or so gathering at Trinity Bellwoods. Any information on that? And on that note, there will continue to be protests in the city and rallies and gatherings. There are more than one scheduled for this Saturday. Are you concerned that people are now, or is it your sentiment that people are now disregarding social distancing advice altogether?
So to your first question, Christina, I don't have specific information on any cases that may have arisen as a result of the gathering at Trinity Bellwoods Park. Certainly we are keeping an eye on the data. As I look at our data, we're sort of hovering around the same level. We are now about a week and a half out since the gathering in Trinity Bellwoods, so I would expect that we would have seen something by now, but I'm happy to go back to my team and consult further to see if there are specific information, or if there is specific information in that regard. Around future gatherings and issues, I certainly hope that people still understand that we are in the midst of a pandemic and there is still COVID-19 activity in our city. And to that end, physical distancing continues to be the mainstay of prevention. Of course, it's important for those who have been identified as a case or those who have symptoms. Those individuals should absolutely be staying home. And for those who have symptoms and are yet to understand what their disease is or what they're sick with, it would certainly be worth going out and getting testing. And we know that that testing is widely available and is certainly recommended for those who have symptoms of illness. But I can't emphasize enough that we are still in the midst of a pandemic, and the best way to prevent spread of disease continues to be staying home if you're sick, washing your hands, and maintaining appropriate physical distancing, because we know how the disease is spread, and physical distancing effectively prevents that transmission.
Thank you, Dr. Davila. My next question is for Mayor Tory. Mayor, obviously businesses in downtown Toronto, they're businesses, they're privately owned, and these are, the management for these companies would determine and decide for themselves how to manage and move forward and proceed. My question is about these businesses boarding up the glass for their stores out of an abundance of caution because of protests coming up. We know that there's at least two, we understand, on Saturday, protest or rally. We're hearing of some even before then. Do you recommend, do you advise that a business do that out of an abundance of caution? Or do you think when people see a boarded up business, it almost sends the message that there is a concern that there could be looting, and it perhaps in a counterproductive way encourages that behavior, unfortunately, by some people who may not be part of any of these peaceful gatherings?
We have not given any such advice. I think my job in the circumstances has been to stay briefed, which I'm doing on at least a daily basis with the Chief of Police, including today. and to express the hope, which I do, that the kind of behavior we saw last Saturday, which was such a reaffirmation of the fact that in the Toronto way, we can protest and express our views on very deeply held feelings about anti-black racism and related matters in a peaceful and respectful and civilized way. And I can only express the hope that any demonstrations going forward continue to do that in the Toronto way, which is to be respectful, to be civilized, and to at the same time make our views known on these things, which are views that I think we share as a community. And so I hope none of those kinds of measures that have been undertaken strictly on the basis of judgment exercised by those private sector businesses will be necessary, because we will find that, as we usually do, Torontonians behave in a particular way that I think is part of why our way of life is so admired.
Okay, thank you. Next question is to Mark McAllister from City News. Go ahead, Mark.
Mayor Tory, we've discovered that Chief Saunders has sent a video message to members of the Toronto Police Service acknowledging anti-black racism as an issue, reassuring its members that things are being done. I'm just curious, from your perspective, is everything being done right now in the wake of all that is happening, and what more does Toronto Police have to do at this point to step forward?
Well, in the case of Toronto Police, I think the Chief and the members of the Police Services Board, of which I'm one, would be the first to say that there are many more things we have to do. We have new training programs, that we're discussing with the police as part of the city's Confronting Anti-Black Racism program. Again, the first of its kind in North America. There are people integrated into the Police Services Board accountability mechanisms to talk about just that. I met with the Confronting Anti-Black Racism Unit members, some of them today, to discuss things we as a city could do to reaffirm something that we've stated very clearly in the past, which is that there is anti-black racism in Toronto. It is a reality. You don't have to hear too many stories about people being followed around stores when they go to shop when they're black, or the experience of what they call driving while black, or the challenges people face in getting a promotion or just getting a job, to understand that these are still realities for many, many, far too many people. In fact, anybody more than zero is one too many. And so I think with policing, as with other things, and it's part of the Anti-Black Racism Unit's mandate, is to look at ways in which we can continue to improve policing, and that's a continuous process, and we are very much on it, and will continue to be on it, with these events, perhaps even increasing the momentum with which we address these issues.
Question to you as well, Mayor, and perhaps Marianne Berdard can follow up. There was more action today, specifically at Asquith Green Park, with regard to a homeless encampment there. Wondering if you can enlighten us, and again, respond to the fact that there are people there that continue to say there are unclear housing options, despite all the efforts that you claim are being made. Well,
it is my understanding that there was one person who took issue with the process which we followed, and for the, again, so the public understand, we give plenty of notice. We spend extensive periods of time in a sensitive way examining housing options for the people who are in those encampments, make arrangements for them to move to that alternate housing, and then remove the encampments. And in this case, it was my understanding that well more than a dozen people were moved to alternate housing that was made available to them as a result of our Streets to Homes outreach workers. And there was one person who was dissatisfied with all of that, but that at the end of the day, we removed the encampment. And that will continue to be our policy. It is something that is necessary in the overall public interest because of safety concerns, health concerns, and quite frankly, the concerns of surrounding neighborhoods that I think recognize the fact, as we do, that there have to be better ways to house these people, which we offer, and then the encampments have to be removed.
Marianne, could you add to that, please?
Yes, thank you, Mr. Mayor. So we did work with some of our other city divisions today to clear an encampment at Asquith Green. We successfully helped 20 people at that location move into safe indoor spaces. At the end of the day, everybody did accept a referral, and I'd like to commend all the city staff that worked down there today to make that happen. The mayor is correct. We do extensive work in these encampments. 365 days a year, we have staff working with people who are staying outside, developing relationships and developing trust, and helping them make the decision to come inside when we're able to offer that space. And that's what we're doing during the pandemic, and it's particularly important during a pandemic that we enable people to be able to come inside. You know, our crews turned up at the site this morning, and you know, after last night's storm, people were wet, their belongings were wet, and they were very, for the most part, very thankful to be offered a space to come inside. And I think that just speaks to the level of response that the city has had during this pandemic. We've actually been successful in moving 205 people out of encampments since the pandemic started, and we've been able to clear 18 encampments. So that's, you know, a significant improvement in the lives of over 200 people who live in Toronto, and we should be very proud of that.
Thank you, Marianne. Next question is Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Dr. Davila, your Associate Medical Officer of Health told the Toronto Star that it's taking about 2.5 days before the Toronto Public Health actually gets a positive test result from labs. You just spoke a moment ago about the difficulty in asking people to remember everything that they've done for the previous 2 weeks. Can I just ask, how much more difficult does that job of contact tracing become with that added delay?
Well, certainly any delay in time makes recalling and the memory function more difficult. So, and that will have impact on our case and contact management efforts. But that's why we've taken this approach to look at every aspect of our process, those, especially those that are directly within our control at Toronto Public Health, to try to manage those. The turnaround time and the reporting time from the lab, unfortunately, is one of those issues that is outside of our control. And there are certainly a number of those issues as well. But we know that this is an important function, and we know that despite all the things we've done, staffing up, creating a new case management system, working with labs to streamline, working with hospitals and assessment centers to more rapidly identify cases and contacts. Despite all of these efforts, we know that there are serious issues in the system that require system fixes. So we look forward to engaging with provincial partners and other partners in the province, hospitals and labs, to find those system fixes to this very complex issue.
And I'm also just wondering, you know, you mentioned 8 weeks in, you identified the problems with IFAS and asked the city to take that on. We're now months into this. Next week at the Board of Health, you're asking to request the province to start addressing some of these issues. I'm just wondering why it's taken months for you to raise these issues with the province.
So just because the board report is coming now doesn't mean that we haven't raised these issues with the province. We have opportunities to engage with our provincial counterparts, including hospitals, assessment centers, and the lab system. And we do that on a regular basis. We're doing that through this report and engaging and enlisting, I hope, the support of the Board of Health. But we have done this throughout the entire pandemic and will continue to do so on behalf of the residents of Toronto.
Okay, thank you. Next, we go to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi. First question is for Mayor Tory, and this is on behalf of my Vancouver colleague, Alex McKean, which is there being some movement there to allow people to drink in moderation in public parks to encourage physical distancing and let people just enjoy themselves when they can't go onto into a restaurant or a bar as they normally would. Is there any chance we'll be seeing something like that here in Toronto?
I can't answer that question because I think it's a combination of both the municipal and provincial regulation that would come into play. I've said previously that I don't have a personal objection to people who can engage in this kind of activity in moderation, and I've seen it in moderation. I've also seen it to excess, namely when I was at the park, Trinity Bellwoods Park, a couple of weeks ago, and people were carrying cases of beer. So as usual, as with other things we've even discussed today, the question becomes one of people's personal responsibility and the question of enforcement. And so I don't think it's anything that we're looking to deal with right at this moment in time, just because we've got many other things that we have to deal with. But I'm, I guess, not naive, and I know that a lot of this kind of activity happens in a very sensible, refined way. In fact, I've seen it when I've walked through parks as part of looking at active TO and things like that. And if people can continue to behave in a responsible, rational manner, then they will do what they do, and we'll take a look at the regulations when time permits.
Thank you. And my follow-up is for Dr. Davila. Doctor, a little while ago, you gave an update when Toronto numbers on COVID seem to be going in the right direction. You mentioned the doubling figures. The Toronto figures now seem to be, you're, as you mentioned, stuck around the 150 mark for new infections, although the number of deaths is lower than it has been in the past, and the number of recovered cases is, in some cases, higher than it has been in the past. Can you give us an update on the doubling figure, or just kind of where we're at? Are we making any progress, or are we just kind of stuck on a plateau?
Well, I think you're already alluding to some of the progress we're making. We're certainly seeing positive signs in respect of hospitalization numbers and in the number of outbreaks. So we are seeing the impact of public health measures in a number of different measures that are out there that assess how we're doing on COVID-19. And when I looked at our data most recently, earlier this morning, in fact, I can tell you that the reproduction number is also moving in the right direction. This is the number of new cases that emerge as a result of each new case of COVID-19. So we are seeing that move in the right direction. The important part here, of course, is that continuing to do that, continuing to see the kind of progress we want to see, will depend on us continuing to stay vigilant and to stay with those physical distancing measures and to stick to the advice that we've provided. Please stay home if you're sick. Please stay home if you're told to self-isolate or to quarantine. Do get tested should you develop signs and symptoms of COVID-19, and do so in a way where possible to minimize exposure to others. Wash your hands and maintain physical distancing. These continue to be the foundation for our continued progress in this pandemic.
Okay, thank you. Next we go to Francine Copen from the Toronto Star. Go ahead, Francine.
Hi. Thank you. My first question is for Dr. Davila. Dr. Davila, last week you mentioned that you were talking about some of the reasons for the problems in doing contact tracing. And you mentioned that often the information for contacting people is incomplete. And I wondered, do you have more detail about that? Is it incomplete because people don't want to give up their contact information, or is it incomplete because, there's some kind of failure with the way this information is taken down, or some problem with the form? Do you have any sort of more detail on that?
Well, Francine, I think a really fulsome response to that would be rather lengthy, and there are maybe a number of reasons why that happens. But I think if I had to summarize it into a short and simple answer, it would be simply this. Normally, the way it works with labs is that you have a healthcare provider who orders a test, it goes off to the lab result goes back to the healthcare provider. And that healthcare provider then informs the patient of the diagnosis or the result of the test. So oftentimes you're talking about a circumstance where you have more time and there is the opportunity for that healthcare provider to connect directly with the patient. And so they have the information, they have an established relationship. Now we're dealing with large volumes of cases. COVID-19, as I mentioned, our largest case and contact management effort in our history. And we have the need for timeliness as well. So sometimes it's just that the information doesn't make it onto the lab report that we receive at Public Health. So we need to go and find out what that contact information is. That's just one example. Sometimes it's just difficult to assess what's on the form because of the way it comes in. So there are a myriad of reasons. But suffice it to say that we've worked on virtually every aspect that we have control of, and we're continuing to work on those that are not yet finished. But we have system issues here which require system fixes, and we're very keen to engage with our provincial partners, our hospital partners, and the labs to find solutions to fix those system problems.
Thank you. My second question is for Chief Pegg. I think you mentioned that you have a 674-day supply of surgical face masks. And I'm wondering, I mean, in the past, the public has been urged to use, cloth masks so that we don't put the medical supply at risk for professionals. Is that still the case, or can we assume there's no more supply issue with surgical masks?
That is absolutely still the case. The pandemic supply is a stockpile, a reserve stockpile that exists for deployment by frontline and healthcare workers in the event that an incident escalates or the duration of an incident extends beyond what our normal inventories would allow us to address. So, Francine, no change whatsoever to the protocol. The advice Dr. Davila and our public health colleagues have given is that medical masks should rightfully be reserved for the use of frontline and healthcare workers, and those of us that are just moving about the community and may find themselves in a place where we're not able to maintain adequate physical distancing should resort or should use a non-medical mask or a face covering to provide that additional level of protection for those around us.
May I just add to that? Because one of the things, I'm neither an operations expert nor a medical officer of health, but I saw during this first part of this pandemic, and we've been told there's likely to be a second wave, I saw during the first part that in 1 2-week period back a couple of months ago, we went from a few thousand masks being used per day in our own 10 long-term care residences to tens of thousands being used on a weekly basis 2 weeks later. And so it's why one of the things we've been focused on as a group is to make sure that going forward for the rest of this part of the pandemic and any future wave that we are as well supplied as possible. And you get fooled into thinking 679 days sounds like a lot. Well, if you get into a bad scene, with a situation perhaps even worse than we've seen before, it actually goes on you very quickly just to meet your own needs. So I just really commend the Chief for the work that he and his team, Deputy Chief Jessup and others have done, the whole procurement people, because we got to order a lot more. I hope those numbers go up even further and that we're reporting even bigger inventories of those things as just a prudent approach would require.
Okay, thank you. Final question is to Michelle McQuigg from the Canadian Press. Hi, Michelle. Go ahead, please.
Hi, Brad. Thank you. Dr. Davila, earlier in the provincial briefing today, there was some musing about the notion of accelerating testing and employing pharmacies for that purpose, sort of the way flu shots are handled. Wondered if you'd care to react to that proposal.
Well, I haven't heard very much by way of detail, so you're informing me for the first time around, the potential use of pharmacists for testing. I think the important part here is actually having a testing strategy that takes into consideration the best available evidence. Other than that, making sure that the testing providers or those who are actually performing the tests have the necessary equipment and the necessary skills to provide those tests, and ensuring that the tests are made available to those who would most benefit from those tests in convenient and accessible manners, I think are actually the fundamental principles behind controlling disease. I would further suggest, however, that, again, testing is only one element of the strategy. We do have to continue to maintain that physical distancing and those public health measures because it's the sum total of all the elements of the response that actually bring about the desired effect, which is control and containment of the disease.
Thank you. And I should clarify that you didn't miss any firm announcements. It was all fairly speculative at this point. My second question, though, is for Mayor Tory. In light of all of the recent events and scrutiny around how mental health crises are handled by police, wondering if there has ever been any discussion or your thoughts on the idea of limiting some of the money that typically goes to police and investing that in mental health services instead.
People present this as an either-or case, and I just don't accept that polarized decision-making tree. What we have here is we have a need for policing, and we're investing more, and where it's going this year is into things like community policing, so we can have officers assigned to neighborhoods for 2 or 3 years, I think a minimum 3 years at a time, and be in that neighborhood, rebuilding trust and building up trust and, getting to know people, and that's where we're putting a lot of the additional resources. The notion to me that we should be investing a lot more in mental health is not something that is confined to policing. We have an agreement in place right now between the provincial and federal governments in Ontario and Canada to invest more in mental health, and I would very much like to see additional funds devoted to the encounters that are presently take place between law enforcement and people in crisis, which total about, I think, 32,000 per year. And I think many of those, while they might require a response because people call 911, would be better handled if we had the resources to have more mobile crisis intervention teams. So I think this is, though, something that should be coming from the budgets of the health ministries as opposed to being a part of the police budget. So it's one of those things where it's not an either-or choice. We should have both more community policing and more ability to deal with mental health matters with mental health professionals as opposed to police officers who can only be trained, so far to deal with mental health matters. There are many, many things police officers have to deal with in what is a very difficult job. And we're continuously upgrading that training and increasing it, but it's never going to be a substitute for a mental health professional if you can have more of those available given the number of people who are in crisis in our city.
Okay, thank you very much for joining, everybody. We'll see you back here again on Friday, June 5th at 3:45 p.m.